Alright, so we're going to be putting in an NG tube today, and before I start, I'm going to check and verify physician's orders. Okay, we do have an order from the physician for an NG tube. I'm going to gather all of my supplies, gloves, stethoscope, pen light, everything in here, cup of water, basin, pen, NG tube, tape, towel, lubricant. Okay, looks like I have all of my supplies. Now we're going to go into the patient's room. Good morning. How are you doing today? Good. My name's Chloe. I'm going to be your nurse today. I'm just going to be putting in an NG tube. You're having a bowel obstruction, and that acid in your stomach is building up. So just kind of help relieve some of that and just help with that bowel obstruction. I'm just going to provide you with some privacy before I get started. Can I have your name and date of birth, please? All right, Joe Bell, born 8/30/41. Okay. And do you have any other allergies? I see here that you're allergic to codeine. You got that banned. Do you have any other allergies you need to know about? All right, I'm just gonna raise the bed to safe working height for me. I'm going to raise the bed to a 45-degree angle. All right, I'm just going to position this pillow behind your head. Help with that. All right, good. So before I start, I'm going to check for your nares and make sure you have patent passageways before I put the NG tube in. Okay, everything looks good. You don't have a history of broken nose or deviated septum or anything like that that I can tell, so that's good. Airways, passageways are patent. Going to put this towel right here in case we have any vomiting or anything like that. Keep your gown clean. All right, now I'm just gonna measure, see how far we need to put this in. Go from the tip of the nose to the ear to the prostate, about right there. All right, so about 51 centimeters. I'm going to put a mark on there with a Sharpie. And then I'll go ahead and prepare my tape. I'll go ahead and put this where I put the Sharpie marker so I can see it better. All right, I've got a cup and a straw with some water here for you. This is during the procedure, in case you experience any gagging, which is likely because we're putting that tube down your throat. So I just want to encourage you to take sips of water throughout the procedure to help with that gag reflex and just move the tube down your throat. Here's a basin in case you feel the need to throw up or spit or anything. There's that. Okay, like this. All right. Lube. All right, I'm just gonna hygiene. Put some gloves on. gloves are too small. I'll use different gloves. All right. All right, I'm gonna get my lube here and lube the tip of it all up. Make sure that's good. All right, so this procedure is very uncomfortable. Just gonna warn you, be honest with you. So if you need at any time, if you feel any pain, discomfort, difficulty breathing, anything like that, let me know immediately so I can stop the procedure, okay? All right, so here we go. I'm gonna start. If I can get you to tilt your head forward. All right, just try and keep it forward throughout the whole thing. I'm gonna go in your left nostril. Okay, 1, 2, 3. Okay, good, you're doing good. All right, I'm just gonna check to make sure you're not having any coiling at the back of your throat. You can open your mouth. Okay, good. I don't see any coiling, so I'm gonna go ahead and proceed. All right, almost there. All right, good. Take this off. And then mark it with the Sharpie. Get my other piece of tape here. Secure the tube. Okay, then I'm going to pin this to your gown. All right, good job. You did great. All right, now I'm just going to check that gastric pH, make sure we're at a good level. And I'll get my stick here. Just check. All right, looks good. Give you back fluids. I'm gonna properly dispose of all of my equipment. You need a drink before I go? Okay. Remove gloves. Wash my hands. Take this way. All right, so throughout the procedure, the patient didn't have any signs of cyanosis or difficulty breathing or pain or discomfort. Procedure went well. I'm just going to lower the bed back to a low, safe position, but keep the head of the bed raised. All right, I'm going to ensure safety. The brakes are locked. Here's your call light. If you need anything, just press that button, let us know. 2 side rails are up, brakes are locked, bed alarm is set. Bed's in a low, safe position. Call light and bedside table are within reach. And then after, I would document the size and type of the NG tube that was used. We used the left nostril on the patient, Patient took it well. There was no signs of distress or difficulty breathing. And then I would put in a stat order for x-rays, make sure we can confirm the placement of the NG tube. And that's it.